A visit with a psychiatrist is probably somewhat similar, but in some ways different from a visit with a family physician or internist, internal medicine doctor. A visit with a psychiatrist will include a fairly detailed evaluation of moods, mood levels. One of the characteristics of depression is it's difficult to describe. People who've had severe depression will say it's very difficult to describe. Really, they cannot describe it. Severe depression, some people describe as kind of a black hole experience in which it's miserable and they feel like they're sinking into a pit and there's no way out of the pit. That is, of course, one of the reasons people do take their lives sometimes in the middle of depression. That's one of the things one of the concerns psychiatrists have. One of the issues, one of the phenomena during a psychiatric visit will be fairly detailed questions about suicidal ideas, and it's an important part of a psychiatric interview. It should never be omitted. It's been shown that questioning about suicidal ideas does not implant the idea of suicide with the patient. Ideas about suicide are almost universal in a person who has problems with depression. Suicide cannot be predicted. It's been shown conclusively that unfortunately we cannot predict suicide. However, it has been shown that people who do complete suicide almost have always left signs in the previous weeks prior to that. They've almost always had discussions about suicide or casually dropped hints about suicide. And it's been shown that a high percentage of people who complete suicide have had visits to physicians within the last month or so prior to the completed suicide, and that's why psychiatrists will make a great effort to ask about suicide, and sometimes in different ways. Suicide is almost always an ambivalent thing. I'm going to do it. I'm not going to do it. I'm going to do it. I'm not going to do it. It's very difficult to get a simple yes or simple no answer out of a patient about suicide because they simply don't know. But a psychiatrist will ask if a person's had just some tinges or touches of thoughts about suicide, and try to. I myself frequently ask people to put it on a scale of 0 to 10. With 10 being the best possible moods, 0 being the worst possible. 10, that patient just won the lottery. They're on the way to the bank with the check. It doesn't get any better than that. 0 is it doesn't get any worse. They may have a loaded gun to their head or in the process of completed suicide. And then 5 or 6 would be a normal average next door neighbor moods. And patients frequently are able to put that into range of where their moods levels have been between a 2 and 5 or something like that, and they can relate to that. But anyway, an important part of a psychiatric interview will be questions about suicide, and if a person has been having thoughts about suicide. Another important part of a psychiatric interview will be issues about concentration and memory, and this should be interwoven into the interview. It should not be simple techniques such as asking a person to subtract 7 from 100 and then 7 again from 93 and then 7 from 86. But a physician should be able to come up with a good to evaluate a person for their concentration and memory in a realistic way and in a way which is not threatening or intimidating to the patient.